vital for any movement and life. So if anybody asks you what time emotions start from the life, I want to tell you that the sign of the life is what? The sign of the life is, starting the life is what? Crying. And crying is a type of emotion. So emotion is the sign of starting the life. And anytime emotion is off, it means that life is off. No movement, no action, no behavior. Just some automatic actions like respiration, palpitation happens. Otherwise, no action. So basic emotions start from the birth. What are the basic emotions? Including joy, sadness, anger, fear, disgust, surprise, but completely internal. Completely internal. Basic emotion. Another emotion in milestones during development of emotion is social smile. What is social smile? Who knows? Social smiles.
Someone playing with him or
Social smiles means smiling to the others. It's a type of non-verbal communication. See, you should learn in this way, very scientific. Social smiles means some types of non-verbal communication. That you smile to some familiar faces. Do we have non-social smiles to each other? Have you ever seen some babies that smiles themselves without any social communication? You haven't seen? Yes, in babies in 1 month, sometimes you see some smiles, but especially in sleep, when they are asleep. Sometimes they show some smiles, but these are not social smiles. Social smiles mean smiling to faces as a non-verbal communication. You know, some emotional relationship, social smiles. It starts during 2 months, social smiles. Another thing, a stranger anxiety. Who knows what is the stranger anxiety?
when they lose something out of their vision.
No, this is separation anxiety. Separation anxiety develops during 1 year, very late. But a stranger anxiety.
When he wants something.
Do you know what is separation anxiety?
No.
Separation anxiety means when the child is alone and familiar person separate from them, they are anxious. For example, when the mother or father is not in his access or view. We call it separation anxiety. Separation anxiety develops when the child, the baby is 1 year. But a stranger anxiety develops sooner, around 2 months. What time? When they are anxious when some strangers, they see some strangers. For example, who is a stranger? Anybody other than father, brother, mother, sister. Some stranger come and they see. This separation anxiety develops when the baby is 2 months. 6 to 8 months. But separation anxiety develops after that. Understand? So again, what is a stranger anxiety? When the baby sees some strangers. What is the strangers? Some person who baby doesn't know them. We call it a stranger anxiety, 6 months. But separation anxiety develops after 1 year. Because when the babies goes to kindergarten and the mother and father separate from them, this separation anxiety happens after 1 year, okay? But this is very important again. Basic emotions present from the start of the birth. Because basic emotions is the most important necessity for life. Okay. Another thing, this word is very important in occupational therapy. Self-conscious emotions. Self-conscious emotions. What is self-conscious emotion? What is self-conscious emotion? This is very, very special word in psychology. Self-conscious emotions. This is a word opposite to basic emotions. Self-conscious emotions mostly are social emotions, which happens in a society, which happens in communications. Pride, shame, guilt, embarrassment, something like that. But this is the words I wanted to mention. This is very important. I mentioned that in modern occupational therapy, the problems in emotions and feeling of the patient, feeling diseases, feeling disorders, emotional disorders, is because of emotional regulation system. Emotional regulation system, which keep the homeostasis function in emotions and feelings. Self-shooting, seeking comfort, that keeps you, although the situation in the environment is very variable and a lot of problem happens, you learn some emotional regulation strategies. Self-shooting, seeking comfort, and something like that. And another important word during emotional development means understanding of others' emotions. What does this mean? Understanding of others' emotions. What do we call it in psychology?
Communication?
No.
Emotional regulation.
No. No. Understanding of others' emotions.
Understand their behavior?
No. What do we call it? Understanding the other's emotions, which is important. I told you in making relationships is very important, especially when you talk with your patient. You should make empathy. Very good. Empathy. Understanding of others' emotion. We call it empathy. Empathy is acquired through observation of society, social interaction. This is very important. Okay. So, step by step, we are talking about different steps in emotional development. It's a little complex, but now you know the meaning. So, we started from basic emotions, and step by step, complex issues in emotions and feelings are developed during neurodevelopmental period. And this is very important also. You can describe your emotions and feelings. You know that I told you relationships is something that during communication you share your emotions and feelings. And whenever any patient has any problem in development of emotions and feelings, the patient cannot make relationships because the patient should be able to describe their feelings and emotions during neurodevelopment. One thing I want to tell you, for example, one of the problems in autistic patient, because I want you step by step into modern strategies of treatment. And again, I want to tell you that you should be a modern occupational therapist with neuroscience approach. For example, why you should learn about development of emotion, developmental psychology? What is the benefit? I want to give you some example that understand. One of the most complex neurodevelopmental disorders, which the only treatment for them is occupational therapy, is autism. You know what is autism? And one of the most important problems in autism is problem in emotional regulation and relationships. You know that in autism, the patient has problem in social interreciprocity, making and maintaining relationships. This is one of the key symptoms of autism. Social interreciprocity, making relationship and maintaining the relationship. And it makes a lot of social problems for the patient. So we call it disorder, autism, autistic spectrum disorder. Mostly in communication. And one of the most important aspects which produce communication problems and making or keeping relationships is because of problem in emotional development. You know that in autism also, emotional regulation has problem. And mood disorders is one of the most prevalent comorbidities in autism. So why? Because of developmental problem during emotion regulation formation. Remember, one of the most important aspects of autistic patient is some disruption in emotional development. For sure, their basic emotion is good. Even social smiles can happen. A stranger anxiety forms. Separation anxiety forms are very strong. But more higher emotional development is disrupted. Like self-conscious emotions. It doesn't develop completely. Emotional regulation is not developed completely. Understanding of others' emotion. They cannot see somebody say that, okay, why you are so rude? No, the networks has not developed completely. It doesn't mean that autistic patient doesn't want to understand the other's feelings and emotion. The networks didn't developed. And also they cannot even express their emotions and feelings. This is very beautiful word. Vocabulary, emotional vocab. What is emotional vocab or emotional sentences? This is very interesting in psychology, that you use some words which shows your emotion. You like something, you love something, and you can't express yourself. This is very important. And as I mentioned, emotional regulation develops step by step. You know that we have a period of time, even longer than 7 years, emotional regulation systems can develop. And one of the diseases happens because of emotional regulation disruption is what? In past class I told you. Which mood disorder I told you is because of emotional regulation system disruption?
Cyclothymia.
Cyclothymia. That's why if scientifically I want to say what is cyclothymia, at least it could be a type of neurodevelopmental disorder, because the development of emotional regulation systems is disrupted. And all the time you have fluctuation in the feeling, fluctuation. Oh, and also empathy. For sure, empathy in early, for example, school age, for sure is more immature in comparison to secondary school, because the society affects on this maturation of the networks. So for empathy, you should be in the society. One of the most important problems happens, these are some practical points which helps you to understand. One of the most important aspects during Corona, which I don't think that here you had some limitations in, for example, a school or something like that, or you had some very restricted limitations happens in a lot of countries. So they said that emotional regulation development is stopped, because for emotional regulation development you need communication and being in the society. And we predict that for children who were during Corona period restricted in making communication with the society, after some years you will see that we will have increased prevalence of cyclothymia, because their emotional regulation system should develop with communication in the society. For sure, the children should have connection, communication with others, that they can develop their emotional regulation system. And when this emotional regulation system is not mature, leads to cyclothymia. And this is very important, and you should understand all these emotions can be more mature. You have such these networks now make it very, very more complex network. So for sure, better quality of action. Okay. Now here we mention to this point that how this development happens. This development, how it happens. Let me tell you something here. I had to tell you, but it's important for reviewing. we said that what is disease? Any deviation from normal function. But etiologically, we have two types of diseases. What? No, psychology and etiology of diseases. We have two types of diseases, yes. Psychological or mental and somatic. For both of them, etiologically, we have two types of etiology. What? No, this is not etiology. This is based on the course of the disease. We have different types of division. Yes, acute, subacute, chronic is different types of diseases based on the course of the disease. I am talking about different etiology which induce this psychological or somatic disease. Etiologically. Etiology, the cause of the disease. What caused the disease? No. We have two types of disease. I mentioned in past class. No. This is, for example, also, this is the other aspect. Two types of etiologies are functional, I told you. That you don't have any change in the structure. And a structure. What is functional? You don't have any change in the structure. You have normal structure. But structural, you have change in the structure. Structural disorders is divided to two types. What type? Stability. What? No, disability is the complication of disease. We have two types of structural diseases. What? Acute and chronic is about the course of diseases. That you have change in the structure. Neurodevelopmental. What is neurodevelopmental? Means during the neurodevelopment some interruption happens. So for sure you have change in normal structure. And destructive. Means when all the structure of nervous system is formed, some destructive etiologies destroy the nervous system. So you should learn this categorization. We have different types of diseases. Functional, structure. Structural means you don't have normal structure. Neurodevelopmental, destructive. What is neurodevelopmental? Means during neurodevelopment some interruption happens, so normal structure doesn't form. But destructive means after complete neurodevelopmental growth, something destroys the structure. So, in developmental psychology, you will learn that if any interruption happens during normal neurodevelopment, you will have neurodevelopmental disorders like autism, like ADHD. What happens? For example, in autism, the process of normal development of emotional system and the cognitive system, you have some interruption. So this is a type of a structural disease. So, for example, when we talk about that development of emotion, start with basic emotion and develops till completion of this development. How you can understand? With good empathy and emotional regulation, it means that in some neurodevelopmental disorders, you cannot reach to this part. The patient doesn't have mature empathy. The patient doesn't have mature emotional regulation because of some interruption in neurodevelopmental period. That's why I tell you that in my opinion, cyclothymia could consider as a neurodevelopmental disorder in emotional system. Because in cyclothymia, emotional regulatory system does not develop completely. Autism is a neurodevelopmental disorder, which in neurodevelopment of emotional system, you have some interruption. So the autistic patient cannot have empathy. Also depression and bipolar symptoms or syndrome is more prevalent in autism. Cyclothymia, because they don't have mature emotional regulation system. This is what you should learn in developmental psychology. What is the benefit? You should know that emotion develops from the birth till adolescence. And in adolescence, this part. But you should know that most of the time, in the development of some parts of nervous system, environment has very important role. Environment stimulates this process. And when the patient is not in the environment, this development won't be completed. And as I mentioned, we are very, very worried about the prevalence of emotional feeling or other psychological and behavioral problem develops in the children and babies who were in the period of Corona pandemic, because they were not exposed to the environment, and we are sure that these networks won't be completed or mature. Understand? Okay.
Etiology.
Etiology, understand? Etiologically, we divide diseases to functional, structural. Structural to neurodevelopmental and destructive. So we have three main etiologies: functional, neurodevelopmental, and destructive. But in neurodevelopmental and destructive, you have changes in the structure, but in functional, you have normal structure, but neuron does not work correctly. Understand? Okay. So, what has a role in this period of development? Some hormonal changes is very important, and also social and peer relationship, as I mentioned. The patient should be exposed to the society for normal emotional development. And if you have any interruption during this neurodevelopmental period of emotional system, you will be prone to mood and anxiety disorders. So you can understand that from the start of the birth till adolescence and adulthood, you will have a process of development of emotion and feeling. And by the time by completing the networks of feeling and emotions, you will experience more complex feelings and emotions. And with some neurodevelopmental disorders or destructive disorders, when you have interruption in emotional and feeling networks, you will have emotional and feeling disorders. So you can say psychological disorders is the problem which happens in feeling and emotional networks. If this happens during neurodevelopmental period, you will have neurodevelopmental disorders. If it happens after neurodevelopmental disorders, it could be destructive disorders. Or sometimes the structure is normal, but the function of neurons has problem, you will have functional problems, functional disorders. And I told you something, that how you can work on your emotions and feeling. As some training, you should have some training to improve your emotional regulation system. How? One of the most important, which I recommend you to keep yourself healthy mentally, is empowering your emotional regulation system. How? One of the most important of them is mindfulness. What is mindfulness? I told you, I asked you, how many of you during the past 2 weeks, most of the time you were happy, you were satisfied, you were calm and comfortable and thankful, hopeful? How many of you? What is mindfulness? That you can increase your soul, your emotional regulation system is mindfulness. It means that every day, please do it every day for 15 minutes. Just alone with yourself in some very calm environment, good weather, good light. Just alone with yourself, thinking about your emotions and feelings. Just think about that. Are you happy or not? Are you hopeful or not? Just thinking of that, even in a very, very silent environment with yourself, thinking about that, because it's mindfulness. It's empower your emotional regulation system. This is as a sport. Who can put this table on his hand and put it like that? Can you? But with empowering your muscles, very, very good training, after a while you will do that. Also, you should make your brain powerful. How you can make powerful? How you can empower your emotional regulation system? Why? Okay, I will be happy. What's the benefit? Be happy means healthy body. Be happy means healthy prefrontal networks, leads to normal hypothalamus, leads to healthy body. Nobody likes to be ill, nobody likes to be sick, for sure. So, for this, you should have normal prefrontal lobe. How? You should be happy. How? One of the most important sports or training which makes your brain more powerful and better emotional regulation process is mindfulness. Every day, 15 minutes, silent place, good light, good weather, not warm, not cold, that you become completely relaxed. And don't think about anything in the environment. It's possible. And just thinking about your mind. What are you feeling now? What are your emotions? What's thinking? Even it's not necessary to think about the reasons. Just thinking, are you happy or not? It's activate your emotional regulation systems, and you will see after 15 minutes you are better. How? I know nothing is solved. It's not necessary to be solved. Your emotional regulation system is trying to make better serotonergic, norepinephrogenic, dopaminergic function of brain networks. Please, from today, try every day you do this sport. And after 2 months, after 3 months, I will ask you how many of you in the past 2 weeks were more happy, more thankful, more hopeful. The number will increase, I'm sure. And also, something like empathy training. How we can have empathy training? With making communication, with making relationships. Try to make more communications. You have 2 friends, why 3 friends, 4 friends, 5 friends? Try to share your emotions, share your feelings, sympathy, not just empathy. I told you sympathy is forbidden in therapeutic relationships. Therapeutic, not in your friend. When your friend laugh, when your friend cry. It's even activate your emotional regulation system. Sympathy is some sports makes your emotional regulation system more powerful. And some techniques, I think we should work on that. Other stress management techniques, like relaxation. You know what is relaxation? For example, I want to tell relaxation has a lot of strategies, and you can use it in your patients. Remember, for example, you have an adult patient and you want to work on some cognitive skill, and the patient is very stressful and anxious. And you know that this anxiety interferes with the response of your treatment. You should learn some relaxation techniques that makes your patient more relaxed and calm. You know that you try this technique of relaxation technique, I want to tell you. For example, now I want to relax myself. Check it, test it. That you start from all the muscles, order to them to be relaxed. What's it mean? Is it possible? Let me tell you, I want to perform one relaxation strategy. Now, I am in a silent room, good weather, good light, no noise. I start. My frontal muscles, be relaxed. My temporal muscles, be relaxed, and think of that. For example, my cheek muscles, be relaxed. My jaw muscles, be relaxed. My neck muscles, be relaxed. Order to them. And you cannot imagine, after a while you will be like that. Now my face is a little relaxed and it's like that. You cannot imagine, it works. And also you know that in hypnotism the same happens. That you order sleep. You cannot imagine that the professional persons who are professional in hypnotism, you cannot imagine order the person sleep. How? You test in yourself when you are at home, and after a while that you have control your body, even you can order yourself to sleep. It's very strange. You should learn this stress management techniques. We have a lot of, and for your patient, if you have good authority of the patient, how you can relax your patient. You can order to the muscles of the patient, and the patient, anything I tell you, you should perform. Relax your frontal muscles. Relax your eye muscles. Relax your temporal muscles. Relax your jaw muscles. Relax your neck muscle. After a while, the patient is completely under your order. Don't think these are histories, I don't know, something like that. No, these are science, completely science. And after a while, you should be able to control all functions of your body. You know that somebody reached to a point that even they can control their automatic function of the body. You say that it's impossible. No. You know that sympathetic and parasympathetic nervous system is what? Automatic nervous system. There is no voluntary, you don't have any control of them. You can control a muscle. These muscles are voluntary muscles. You can order to them, yes, be relaxed, because voluntary muscles are under your control. Is it or not? Okay, I can close my eye, I can open my eyes. I can order them be relaxed. Wow, this is under my control. I can order them be relaxed. You cannot imagine that some person reach to this point that even they can control their heartbeat. They can control their respiration. They can control their temperature. They can control their stomach function. Completely automatic. Okay, we don't want you to reach to this point. We want you to reach to this point to control your body, emotions, and feelings. You should be happy. You should be hopeful. You should be thankful. We should work on that. A lot of problem, no hope for the future. Yes, I know. So this mood is natural consequence. Yes, I know. But you should treat yourself. You should treat your patient. I told you, okay, work on the patient. Why? Because he is hemiplegia. Okay, what was the problem? A stroke. So hemiplegia is natural that after a stroke you have hemiplegia. So, okay, so you should treat that. Okay, any problem in your mood you have is natural consequence of the situation. Yes, but you should treat that. You should treat for your patient. The patient has a lot of problem. It's natural that he cried. Yes, it's natural, but you should treat that. This crying means that prefrontal lobe doesn't work correct, so hypothalamus does not work correct, so the patient will have a lot of somatic and systematic problems. So this is what I touched in here. And again, if as conclusion, emotion development continues a process through life. And we have a word here. What is emotional intelligence? Who knows? Have you ever heard about that? Emotional intelligence? And if anybody asks me, IQ is more important or emotional intelligence or EQ, which is important for your life? Emotional intelligence or intellectual intelligence? Who knows? Why?
Social communication.
What is the role of emotional intelligence? Who knows? What is emotional intelligence and what is the most important
Understand.
factor affects on emotional intelligence? Yes?
Understand the self and the other.
Very good. One of the most important aspects of emotional intelligence is first understanding your emotional and feeling status, and also understanding the emotion and feeling the others. So, emotional intelligence is very important in making communication. What else is very important? What else?
To make a professional communication.
Very good. What else in emotional intelligence?
Emotional control.
Emotional control. Exactly. Exactly. Emotional control. It doesn't mean that when you are angry, control your anger. Yes. But the most important, means a strong emotional regulation. It means that although the situation is very bad, keep yourself happy. Keep yourself calm. Keep yourself satisfied. Keep yourself thankful. Keep yourself hopeful. This is emotional intelligence. So, when I ask you, how many of you are happy now, it means that your emotional intelligence is weak. Yes, this is natural situation, natural consequence, but is it possible to promote emotional intelligence? Yes. By some sports makes your emotional regulation system stronger. If your emotional intelligence is weak, how you want to make professional therapeutic relationship with your patient? Don't think that empathy means, yes, I understand. No, the patient should feel that you have understood his emotion or her emotion. Don't think that you say, yes, I can understand. No, it's not something by tongue. This is something that the patient can completely understand. Can you understand his emotions or not? So you need to be you have very high emotional intelligence. And even from now you should work on that. How? Relaxation techniques, mindfulness, and some other strategies step by step I can explain for you. So first of all, you should be in normal mood and you should work on yourself. And after 2 months, I will ask you, how many of you in the past 2 weeks, most of the time were happy? Most of you should say raise your hand. But you cannot do it, cheat me, because I am very professional neurologist. I can read your brain, all of you. Somebody was surprised because in the past class, I said that unfortunately in this class, somebody is thinking about what message sent to his friend. She said, how you understand that I can read your brain. You cannot tell me that I am in normal mood, but you are depressed. Please work on yourself. Maybe sometime I decide to give you mark just because of your mood. Or you know, because if you have learned these topics, it means that first of all you should treat yourself. How you want to treat the others, but you cannot treat yourself. Everybody said that you please first treat yourself and then think about treating me. So maybe I decide that just based on your mood status, I give you mark in psychology. Because first, as a project, I ask you, treat yourself. If you are successful, then you can treat the others. Otherwise,
I would say that is an agent, the neurologist also has a book that says no matter how the face of circumstances, but you are responsible of your dream.
exactly. Okay, any question? So first, you are responsible for treatment of yourself. Mindfulness, don't forget. Relaxation techniques, don't forget. And I will ask you, how many of you did that? And anybody say that, yes, I did, but I cheated. Can you tell me one sentence lie, one sentence truth? And I will tell you which is truth and which is lie. Can we have such this? Okay, it's not better not to say because you will say some secret things. It's because you thought about some secret things in yourself. Why you want to tell me? So we will have such these games together. You can have 2 sentences, one of them lie, one of them true. And I will tell you which is true, which is. Okay, next topic.
المرة الجاية المرة الجاية بس
Explain for you what is executive function. In a short and next class, we will talk about. I try to finish the class soon. I know that you are a little tired and it's difficult to tolerate for 8 hours. It's very difficult. And your tolerance and your resilience is very good. And congratulations for that. You should tolerate. Even maybe I decide to keep you here till 7 p.m.
It's okay.
It's okay. You should stay together. No, not that. You should just look at it. I want to have a practice to make your brain powerful, increasing your resilience. Okay. So, thank you very much.
Thank you. We trust you.
I want to explain what is executive function. I told you that the main focus of your field is on executive function schemes. That's, I want to write it very, very small. We talked about emotion and feeling and here. From here, decision making from here. Okay. From here we call it executive function. Okay. Anytime I return back at somebody, see, I remember Muslim and I don't know why. Okay. Executive function starts with decision making, and thinking is the main part of executive function. Thinking is the main part. And during thinking, you decide and you start execution. Execution means action. But this is very important. What happens during execution? Again, the main thing is thinking. Planning. How to reach to this goal. What is decision making? Thinking. Yes, thinking for what? Choosing the goal. Thinking, choosing the goal. How you decide? Decision making, choosing the goal. You say that, okay, choosing the goal, it means what? From which options? Okay, you compare what? Which information you process in decision making? Yes, exactly. Which one means which, from which one? Which one of which?
Environment.
Just two. Okay, which one? Okay, I want you. Different options. Choosing from different options. What are these options? Hmm? Culture, yes, very good. What else?
Rules.
Rules, very good. Experience, very good. What is culture? Who knows? Culture means the other's reaction. This is, for example, smoking. This class is counter the culture. Rules of the society. In this university, smoking is forbidden. Experience. I know if I smoke, I will have some problems. Family is culture. Facts. Very good.
Oh,
Bravo.
yes.
Have some knowledge about that this smoking has some problem. What else? This is the option that you decide. Feedback of the others, you mean this is in experience. And also culture. Feedback is based on the culture and experience. And also rules. Results again experience. Your past experience. What was the result of this action? Very important remained. Most of your decision makings are based on what? Emotions, exactly. Your emotions and feeling. You like to do it and you do it. Don't think that decision making most of the time is based on the culture, rules, facts, experience. No. Most of the time based on your emotions, based on your feeling. You know that in OCPD, obsessive compulsive personality disorder, their action is not based on their emotion and feeling, and it's not good. But in bipolar mood disorder, in mania, most of the decisions are based on feeling and emotion, and again, it's not good. You should have a balance between these types of decision making. Whenever you want to choose your goal, this decision making is through logical thinking about the culture, rules, experience, feelings, emotion, facts, and after that, memory is your experience. And after that, you choose your goal. How you analyze this part? Thinking. So decision making is the first step of executive function. Okay, you chose your goal. See, I know that this is very professional that I am teaching you executive function, because I am sure that neurologist doesn't know in this detail what is executive function, but why you should learn it in this detail? Because this is your job. Neurologist just ask you to improve the performance of the patient. And even he doesn't know that this improvement in performance of the patient is true improvement in executive function skills. When you want to work on autistic patient, mostly you should work on executive function skills of autistic patient. Decision-making skills. Okay. After decision-making, planning, what else? For what? How to reach to this goal? This is planning. How to reach to this goal? What else? During action, during execution. Thinking, do what? One, planning. The first was decision making, choosing the goal. The second is planning. What is planning?
Problem solving.
No, the definition of planning. Exactly. How to reach to that goal? We call it planning. Okay, you decided your goal, but how to reach to that goal? We call it
The road.
planning. What else?
Choose the road.
You mentioned
Problem solving.
problem solving during this process. Maybe you reach some obstacles. What is problem solving? Who knows? The different steps of execution, you should know this in details. From everybody ask, problem solving means any obstacle you should solve. What? The occupational therapist, the cognitive scientist should say that problem solving means the person can determine any obstacle and solve that. Problem solving doesn't mean just solving the problems. problem solving, very professional, it means finding the problems and solve that. Very important. Should be very, very powerful scientists. And I want to give you some very important tasks. I told you that you should be responsible for promotion, upgrading the IQ of your society. That you say that fortunately here birth and bearing is good in good amount. Unfortunately in Iran the birth is very low amount. But here is a young society and you inform to the society with you have some strategies and plans for normal children to increase, to upgrade the IQ of the children. You cannot imagine that how everybody comes to you. But is it real? Yes, real. How? To improve executive function skills of the babies, of the children. You can increase the IQ. So you should understand when we say that one of the most important aspects of IQ is problem solving. What is problem solving? The skill and the ability of finding the problems and solving. So again, how you want to find the problem? Again, thinking. And how you want to make a solution? And see exactly as I mentioned that decision making means deciding, choosing the goal based on different aspects. Also in problem solving, don't think that it's easy and no, means finding the best solution. You should design, I am working on that designing some games that the boy, the child, and any person in this situation, he or she has different solution. For example, you should find a problem in the game and finding the best solution. How we can understand if you choose this solution, you can reach to this one. But another person, let's find another solution, it reaches to this point. And when the other finds the best solution, it reaches him to the goal. In this way, by these sports, children practice upgrading executive function skills, upgrading the IQ. You cannot imagine that what happens in your future job. And then you should think about how I can manage this amount of clients come to me. So again, don't think that, okay, problem solving is finding the problem and choosing the best solution. What else? Shifting. Anytime you understand, you reach to this point, that the point is wrong, change your way. And even inhibition, and this is very important. Again, I want to tell you another new subject because this is very complex. I want to tell you another complex. That for all these processes, decision making, planning, problem solving, shifting, inhibition, you need a very, very important cognitive process. We call it working memory. And you know that working memory is one of the most important aspects of your job. So that how we can improve executive function, decision making, planning. problem solving, shifting, inhibition. How? One of the most important strategies you can improve executive function of the patient is improvement in working memory. When you improve working memory, you can improve decision making, you can improve planning, you can improve problem solving, you can improve shifting, you can improve inhibition. And what is working memory? Means recording every information during your action. Because for analysis between different things, you need working memory. Working memory is at the same time analyzing different aspects and what is going on in the environment. Because the most important thing, live, you say Basher, live, for example, live program, Mubasher. Mubasher. That's at the same time what is happening. Working memory is recording any information which is working lively, and based on this information, compare it to the culture, compare it to the rules, compare it to the past experience, compare it with your feeling now, your emotion now, the facts. And working memory collect all of these to be analyzed and then decision making. Working memory can find the problems and analyze different solutions موجود in the environment and then collect between these solutions. Planning based on working memory, that see what is the ways and then choose the way to reach to. It needs working memory, needs recording the information lively, what is happening, and then based on this you decide, you plan, you find the problem, you solve the problem, you stop. This is working memory. And which part of brain is responsible for working memory? Huh? Who said? Prefrontal lobe. So, prefrontal lobe is which part? For feeling. So when you are not in good mood, for sure your prefrontal lobe doesn't work, so your working memory doesn't work, so you cannot have good decision making. You cannot have good planning. You choose wrong way. You cannot solve any problem. You cannot inhibit or shift. So addiction in depression is more prevalent. Why? Why addiction is more prevalent? Why? Because when your prefrontal lobe doesn't work, your working memory doesn't work, so inhibition doesn't work. Your decision making doesn't work. You just work based on your emotion and feelings. I like to, okay, a lot of problems, cultural rules, complications. Okay, you did that. Why you cannot inhibit? It's very, very easily we can. This is neuroscientific approach I am telling you. That when you learn neuroscientific approach, then you can understand. If anybody asks me, what is the main treatment of addiction? Occupational therapy. Occupational therapy, treatment of addiction? Yes, the only treatment. Why? Because you should work on executive function. The problem is in executive function.
Not psychosocial.
See, the reason is psychosocial. But these psychosocial factors affect on your executive function. So with neuroscientific approach, you say that, okay, this is exactly what I mentioned. Okay, depression is because of psychosocial problem. But what this psychosocial affects on feeling networks and makes disease. Exactly in addiction happens like that. A lot of psychosocial factors affects on your executive function networks leads to addiction. Okay, can you change the psychosocial factors? No. This is not your job. This is governmental job. But what is your job? Okay, natural consequences of some psychosocial problems which affects on executive function networks. Now what is your job? Improvement in executive function networks. See, this is what I tell you. Modern occupational therapy with neuroscientific approach is that. You can treat addiction. So that, okay, addiction is the natural consequence of some social problems. Yes, so you don't want to treat it exactly like that. Okay, I have a car accident, 2 legs is broken. Okay, this is the natural consequence of the accident. So it means that you should not treat that. Yes, you should treat that. See, this is the reason. But now this affects neuroscientifically on your executive function networks. So now you should improve with some occupational therapy procedures. Although you cannot change the society, but you can improve the complications of this social problem. Understand? Well, so next session, I will try to finish next session.
Executive.